To further discuss our theme today of living with COVID, I'm delighted to say that we have a panel of guests who have joined us now in this studio. Hopefully, through this discussion, we'll be able to explore some of the risks and challenges that lay ahead, as well as lay to rest any misconceptions so that we can get a clearer picture of what to expect in the coming weeks and months, our new normal, as they say. Let me go around the table now and introduce our guests. First, we have Dr. Jerome Kim, the Director General of the International Vaccine Institute, which is an independent non-profit organization dedicated to helping discover, develop and deliver vaccines for global health. Dr. Kim, welcome back on the show.
Thank you.
And next to him, we also have Dr. Lee Han-sung, a doctor of internal medicine at Severance Hospital, one of the nation's oldest, largest and most prestigious university hospitals in Korea. Dr. Lee, it's great to have you in the studio for us today.
Thank you for inviting me.
And for the first time on the show as well, we have another Dr. Kim, Dr. Kim Seung-taek, head of the Zoonotic Virus Lab at Institut Pasteur Korea, a research institute member of the world-renowned Biomedical Research Center, Institut Pasteur. Dr. Kim, welcome to the program.
Thank you for having me.
Now, to kick things off, I thought we'd start with a quick overall assessment of the current COVID-19 situation in Korea and the nation's handling of it. Let me start with you, Dr. Jerome Kim. How would you describe South Korea's handling of the pandemic?
So I think it's important to take this in context. I'm an American. And so what is the government supposed to do? It should minimize the impact of the disease on society. And it should, as much as possible, allow the country to continue to function economically. And you know, when you look at the United States, you see probably not such a good picture. But when you look at Korea and the number of deaths Korea has had in a pandemic that has killed 4.5 million people around the world and infected over almost 300 million, Korea has actually done pretty well from the perspective of preserving life and minimizing the impact on the Korean economy, which has grown faster than most of the other economies in the world. So from that perspective, you know, the government did well, considering the circumstances.
Dr. Lee, what do you think? Especially coming from South Korea. Some South Korean people have expressed concern about perhaps South Korea's slow acquiring of vaccines and perhaps some of the social distancing regulations, about some confusion over there. What do you think?
So I think, let me just comment on the current situation of Korea. I think the current state is, the current status of Korea is there's this force that propels the pandemic and many factors and measures that suppress it. They're kind of in a equilibrium state. And I think what the government has done well, despite the accusations that they acquired the vaccines pretty late, is that they have turned this thing around and through aggressive vaccine campaigns, I think the pandemic response is driving in sort of a right way, but there still are three major events or developments that can turn the situation into make the situation take a bad turn. First one is Chuseok, of course, the biggest holiday. There obviously will be many people moving around the country, which will probably provide the virus to spread from the hot zones and seed into the effectively low affected areas. Second one would be our weathering of the challenge, the dual challenge of battling not only against COVID-19 but also the influenza. Right. And the third one is the emergence of various strains that could render the current vaccines ineffective. So how the way the Korean government handle those can dictate how we will fare in the late winter, right, and in the coming days.
So some concerns there expressed by Dr. Lee Han-sung. Dr. Kim Seung-taek, what about you?
Well, actually, experts actually talked about some general things and then some surrounding situation. And I think that most of the the thing that we have done so far, I think the mostly just a government-driven just efforts, and then the people somehow just voluntarily just follow despite of their loss and the sufferings. And but I think to the most extent, I mean, we actually learned great lessons from the MERS outbreak in the year 2015, and then that was we had made some mistakes, but then there was a very just a big lesson. So then that's how we can just come up with some better just a response to the this current COVID-19.
Right, so the 2015 MERS epidemic perhaps laid the groundwork for us to, South Korea at least, to better deal with the current situation that they found themselves in with this COVID-19 pandemic. Now, South Korea is racing towards its set target of vaccinating at least 70% of the population with 2 doses, and it looks like the nation is on track to achieve that before November. Dr. Yi, in your opinion, how important do you think it is to reach that target now?
Well, as you know, our country has a robust, easily accessible healthcare system, which can support our aggressive vaccination campaign. So I don't think many people doubted or disputed the fact that the Korea government, as announced, could reach its goal. But achieving herd immunity is a totally different story. In order to achieve herd immunity, the total population, out of the total population, 80 to 90% maybe, has to have some sort of immunity through various methods, which includes, getting the shots or getting infected themselves. Given the reduced efficacy of the current vaccines, especially against the Delta variants and the upcoming strains, I don't think it's possible for us to achieve herd immunity per se. But as we see in other countries like Singapore and Israel, which have done a tremendous job in getting 80 to 90% of the population with the full doses, but their cases seem to go up day by day. So I think there needs to be another layer of protection, maybe a booster for a third shot for many of the population.
Dr. Jerome Kim, what are we seeing around the world with the effectiveness of vaccines and this idea of herd immunity? South Korea had initially set 70% of the population vaccinated, and that would help us get to herd immunity. Is that still the same now?
So that's a great question because, when we look at the different vaccines that are in use around the world, the efficacy, which is tested in these big phase 3 trials, goes anywhere from 50% to 95% in the case of the Pfizer mRNA vaccine. And so people think, well, then obviously Pfizer is the one that we need to take. But when you look at effectiveness, how well does the vaccine actually work when it's not in a clinical trial, when it's out in the community under real world conditions? In general, the vaccines have all been, 75, 80, 85% effective in keeping, in reducing severe infection. And hospitalization and death are even higher in terms of effectiveness, and they tend to group at above 80%. So the vaccine, when we look at the real world data, the vaccines look a lot more similar. And the ones that are approved by WHO actually do show data. The problem is we have a lot of effectiveness data from high-income countries, from the United States, from Israel, from the UK. But we don't have a lot of information on the use of vaccines, and particularly the lower efficacy vaccines in low and middle income countries. And those are the countries more likely to use them. And what we're seeing is that, we already knew that the vaccines weren't going to prevent infection, which raises a big question about whether they prevent transmission, which is a big part of herd immunity. So the idea is you vaccinate enough people, and the vaccinated people protect the unvaccinated people. But the problem with COVID-19 is now we have the Delta variant. And it looks like even if you get the Pfizer vaccine, the amount of virus that you have if you get infected in your throat is not different comparing unvaccinated and vaccinated. And that may mean that you're able to transmit as efficiently. And that's actually a difficult problem. The only benefit is that the duration of the positivity appears to be shorter if you're vaccinated. So again, there might be an effect. But what we really don't understand is the indirect protection, which is a part of the impact. And that's where herd protection comes in. And we don't have data yet. And I think that those studies are going to be important because in the end, to have herd protection, we need to break transmission. And that's proven to be much more difficult than we thought.
So it seems like there's still a lot of question marks remaining. Dr. Kim Seung-taek, do we still need, though, at least 70%, 80% of the population vaccinated? Is that a target we have to get to? Is vaccines really the only way to tackle the COVID-19 pandemic?
Well, vaccine is by far the most important just a weapon that we can just try to use, and then it should be just so low cost, and then it's gonna be just used for as many as possible. But then we need some another weapon. I would say just compare this vaccine as the shield, and then the drug as just the sword. And then there are many just some drugs already being developed and being used.
You mean for treatment?
Yeah, for treatment. And then there are also some drug candidates that are being actually tested in maybe some phase 2 and phase 3 clinical trials right now. And then for just concerning the so many just treatment options for right now is there are some. And then I want to actually emphasize that no single drug can treat all the patients of COVID-19, because COVID-19 is sometimes the people call it a biphasic disease, which means it has two different periods or phases. The first phase is the sort of just a virus replication phase, and the second phase is inflammatory phase. So depending on the which phase or period those COVID-19 patients are, we have to use different kinds of the drugs. So, for example, one of the first drug that has been just developed and approved was the remdesivir, and then this is the injection drug, and then used for some the patients with the severe COVID-19. And then there are some other drugs such as some monoclonal antibodies, and then so far 4 different monoclonal antibodies were actually successfully developed. The first two were actually developed from the U.S. companies Eli Lilly and the Regeneron, and the third one is Celltrion, the Korean company, and the third one is Vir Biotechnology and the GSK. And all those the monoclonal antibodies actually just block the virus entry. So it has to be used in the some early phase of just a COVID-19, and then efficacy is pretty good. I mean, they actually just blocking the transition, the progression to the severe disease by approximately 70 or 80%. So thereby just reducing the mortality. And the other drugs we can talk about is like dexamethasone, and then that's the steroid drugs, and that was actually proven the clinical efficacy in the UK, some extensive clinical trials. And then recently some tocilizumab and then baricitinib also just were proven some clinical efficacy for the patient with some severe some later phase of the COVID-19 as well.
So not just vaccines, we need treatment to at the same time to deal with the pandemic moving forward as well. It's an important weapon, as you've put it. Let's talk about how to live with COVID-19 now. The government said it will start considering a transition to the COVID-19 management system in November after 70% of the population has completed full vaccination. That's 2 shots. Senior Health Ministry official Song Yong-rae said last Wednesday the country is likely to see the benefits of expanded vaccinations from November, such as in reduction in new serious and fatal cases. The government plans to transition into a system that focuses on the management of serious cases and death toll over just reducing the number of total cases. Dr. Yi, do you think we're ready to move into this new transition?
Well, I myself, I think that the conversation is a little premature. It would send the wrong messages to people, to the public, that the pandemic may be over, and embolden people in the wrong ways. It is important for the government to plan early and get ready, but the implementation should start at least after the flu season, because we have the challenge of fighting those 2 diseases in the same period, and the COVID-19 itself is putting a lot of strain on the healthcare system right now, and we don't want to complicate things at least for a couple of months. So I think what the speaker said was to kind of encourage people, but my opinion is it's a little too early for the conversation. We should get ready, but it's a little too early.
Dr. Jerome Kim, do you think it's too early?
So at this point, I think, the government needs to start thinking, which is exactly the point Dr. Lee made. The government needs to start thinking about the system that it will use at the point where enough people are vaccinated that we don't necessarily have to feel that we have to track every last person, that we're really monitoring hospital utilization in ICUs. But that's going to be a complicated formula and require very, very close attention. For instance, we're going to have to keep up surveillance because we need to know if a new variant appears in Korea or elsewhere. And we can only do that if we maintain some level of testing and sequencing. And it has to be complete because I think we've been unfortunately surprised too often with COVID-19, and the efforts of the government are very laudable, but it's difficult to go backwards. And we also found out actually earlier this summer even that if the messages are not absolutely clear, they become very difficult to enforce and they get very difficult to get people to follow. So they have to be very careful and plan very, in the same way that they planned in the beginning parts of the pandemic. They're going to need to use their experience in the last series of outbreaks to really understand what it will take, what their backup plans are, and then prepare people for it because the communication of these changes is going to be very important. I think the one last thing is, there's already modeling data that, especially with the Delta variant, that we should not just take off our masks. That even when we get to 70%, we have to be very careful in the combination of what we call non-pharmacological interventions, so NPIs, which are the masks and distancing, in addition to vaccine, are going to do much better than vaccine alone. In fact, if we go without the masks, the modeling suggested, and this was before the U.S. actually experienced it, that you could actually prolong a pandemic with Delta. So I think we have to be very consistent in messaging and continue to be consistent in messaging around the vaccine and other preventions as well.
Dr. Kim Seung-taek, what do you make of the government's plans that they've announced so far about transitioning into a new phase?
Well, as two just experts just talked about, I think just a transition. I mean, mentioning the transition should just also just accompanied with some other precautions, just some explanation, like for example, like after vaccination, the vaccine is not actually it was actually pretty effective that we are actually using right now. The vaccine actually developed to just prevent disease, not the infection. So for example, like lifting just a mask mandate it's not really a good idea. So at least even after just the transition to just a normal just life, we at least for the short-term period, maybe at least for short-term period, we should just keep the masking, wearing mask, and keep this maintaining just a physical distance. That's very important. I mean, considering the principles of the vaccine development that we have right now.
In earlier interviews that we had on the show today with Dr. Brian Kim at the KDCA and Dr. Cyril Cohen in Israel, we talked about how when restrictions were eased, there was a spike in infections, even though there was a very high vaccination rate among the population. Is that something we should be expecting as well, Dr. Kim?
Well, I think that's actually, even after vaccination, we actually also just think about some human behaviors. Because there are certain people, for example, like some anti-vax groups, or some people like really just afraid of the vaccine because of some side effects. So there are still some vulnerable people to infection. But even after just the vaccination, like I said before, the even vaccinated people actually can be vulnerable to the infection. For example, like in this case, we are actually talking about some boost the vaccination. The reason one of the reasons why we talking about the booster is the immunity wanes over the time. One of the main key player after vaccination is the neutralizing antibody. That actually circulating antibodies, where over a period after the completing vaccination, that actually just wanes. That's pretty known the fact. But the other the key players of vaccination still just seem to be pretty good. I mean, just protecting actually preventing just a severe disease. For example, like a T cell immunity and also some memory B cells, memory T cell. But actually just the immunity is waning, so that we have just in this case maybe at least for just we can be vulnerable to the infection. So that considering that kind of just a scientific evidence, we should just keep at least some control measures to be maintained.
We've mentioned the booster shots a couple of times already. We talked earlier on the show in Israel. They've started their third rounds of shots. They've began their booster shot program in August. When we spoke to Dr. Brian Kim from the KDCA, he said the South Korean government is still watching the situation, that they want to give the extra shots, the booster shots, to those in the most vulnerable groups, but for the wider public, that they're still waiting to see more evidence, and that they're still waiting to see, you know, whether it's needed. Dr. Jerome Kim, what do you think about the need for booster shots? Should South Korea be thinking about that?
So I think that if a person has a condition, an immunocompromising condition, something that decreases their ability to defend the body against infection, that they may need booster shots. And I think that's pretty clear. What's really not clear, and actually some colleagues of mine wrote a commentary in The Lancet published in the last few days, where they really, I think, very convincingly argued that we think that, well, what we know about the booster doses is that they raise the level of protective antibody. But what we don't know is whether that actually corresponds to increased protection against severe infection, hospitalization, and death. And that is actually what we want the booster doses to do. There were concerns and reports that the effectiveness of for instance, the Pfizer RNA vaccines were dropping over time. The problem is that at the same time that was happening, a new variant had appeared, Delta. And we already know that Delta doesn't respond as well to the protective immune responses that are generated by the vaccine. So, really we need to wait to see that these boosters are actually doing something other than protecting cells in a test tube. And are they really protecting people from the outcomes that we need to avoid? There is now one study out of Israel that was published, I think, yesterday or the day before in the New England Journal of Medicine that suggested that they do, in fact, and particularly in the older age groups, see some level of reduction in hospitalization. That needs to be confirmed, like many things. I mean, the U.S. didn't see necessarily the same impact of Delta on effectiveness as they saw in Israel. And again, these get to the way when you're doing a clinical trial in a very controlled situation, you have a very clean answer. When you're looking at data from the real world, you have to deal with all the different things that happen in the real world, and you have to control for them using statistical means. And that actually sometimes causes things to look either worse or better than they actually are when we do additional studies. So just a caution about making sure that we have the data that the vaccine is actually protecting people against bad outcomes.
So I feel like you're saying we don't really know yet whether we need more booster shots, or whether that will be something that we live with in the future. For example, we had imagined that perhaps with booster shots we'll need a booster every year or every few months to keep our immunity against COVID-19 up. Is that not the picture? So
if the question is, do I believe that there's a booster in our future? I think that's correct, that there is. When is the big question. And for instance, I received the Johnson & Johnson vaccine, and it looks like the levels of neutralizing antibody for Johnson & Johnson are stable out to 6 months, and that it may be that the booster doses are necessary at month 8 or month 9. With Pfizer, it looks like the antibody levels drop, but they're dropping from a very high level. So the question is, do you really need that much antibody, and do you really need to have 10 times more? Is it really going to protect? It's like we're wearing 5 raincoats instead of 1. Those are important questions because the amount of vaccine that we have right now is limiting. And in the poorest countries of the world, only 2% of people have received a single dose. And we know some things, right? We know that there are outbreaks, and we know outbreaks generate variants. And we know variants cause outbreaks, and that is a vicious cycle. And we can only break that cycle everywhere in the world if enough vaccine gets out to everybody. And so the timing of the booster doses needs to reflect the science, and also should consider the bigger picture of the pandemic, because everything that's happening in a place where a pandemic outbreak is occurring that we don't know anything about, and variants that we don't know anything about, raises a threat for all of us. Maybe not today, but maybe tomorrow or a month from now.
Dr. E, can you maybe try to paint a picture for us then, after everything we've talked about today, and in your expert opinion, how we what the picture is going to be like for how we live with COVID-19 in the coming weeks and months, considering what the government is saying, considering what the effectiveness of the vaccines we know so far, whether we're going to need booster shots. How would you describe to the people, how would you prepare them for the future?
So I don't expect it to be much different from what we are experiencing right now. Maybe they will let us take off our masks outdoors, but the mask mandate for indoors will strictly be enforced. Will probably be subject to thermal scans and verifications of visits when we enter buildings or restaurants or any businesses. The booster shots, that's a tough question. If we had enough, I think the government would not hesitate giving them around, especially for the vulnerable population. But it is what it is. We don't have them. So I think they're trying to decide which population to give it to, because if you want to, prevent people from dying or keep people out of the ICU, I think the way to go is giving the booster shot, the third one, to the vulnerable population. As Dr. Jerome Kim mentioned, the people with immunocompromised situations or chronic diseases. If you want the economy up and running again, it's important to give the full doses to the general population. While they are deciding on that, it's going to be a tough question, which involves ethical dimensions, and I really hate to be in the shoes of those who are stirring those kind of decisions. But the scene that I mentioned, the masks will still be there. I don't think they will let us, take off masks indoors.
So, Dr. Kim Seung-taek, I think you will also agree that masks will still be around. But what else should we be looking out for? How else do you think you would prepare people for what's coming ahead?
Well, since we already talked about just wearing masks, I think another thing that I want to just emphasize the complete vaccination schedule. Because according to just a recent report, that there was some efficacy just changes for like an Alpha variant and the Delta variant. That was the test result for just the AstraZeneca vaccine and then the Pfizer vaccines. So after first shot, the efficacy was less than 50% for both, for both variants. But after second shot, then the efficacy actually just increased by about just 40% or 50%. So I think that's pretty good scientific evidence that show why people just should just complete their vaccination schedules. So that is actually very good. And now just we are actually approaching the 70% of vaccination, the first shot in Korea. But now now it's not the time to just relax and then we have to just keep going and then just complete our vaccination schedule.
You say we have to keep going, but for people, we want to lift restrictions. We want to meet people again. We want to go back to some sort of normalcy. Is there no roadmap for that at the moment?
The completely taking up a mask, I think we should wait for still just maybe I cannot tell for sure when it would be possible, but at least for earlier next year, no, I don't think so. But for a while, yeah.
Well, we're approaching the end of our time already, but perhaps we can end by just giving us your final thoughts as we go around the table. Dr. Jerome Kim, perhaps a message to our audience about what we should expect in the days to come.
So I think that it's important to remember why we wear masks. And I wasn't a big mask believer, actually, in the beginning part of the pandemic, because most of my experience was coming from our medical experience in using masks to prevent, say, influenza. Masks work much better protecting other people from you than they do protecting you from others. And their ability to protect other people, if you happen to be affected, is substantial. So the reason to keep wearing masks isn't because you've been vaccinated or isn't because we know that it's going to protect you from infection. The reason is that you want to protect the people around you, the people you work with, the people in your family, the people you go out with. You want to protect them from infection. So I think we have to change our thinking about masks to understand that this is something we do for everybody. I think that the second part of this is, and this gets to, I understand the government is justified in saying we want to protect the Korean people first because that's their responsibility. As a global health person, I'm thinking about the 98% of people living in low-income countries who haven't been vaccinated yet. And I'm thinking that, not only have they not been vaccinated, but they don't have enough diagnostic equipment for us to even tell that they're having big outbreaks. And that's a blind spot. And we don't know what variants are there. That's another blind spot. And again, these are things which in the longer term could seed the next outbreak of vaccine-resistant COVID. And we need to know that before it becomes a real problem. And so there's a lot that Korea can do in terms of global health leadership and helping countries understand what the nature of the pandemic is. And then ultimately through the Korean vaccine industry, providing vaccines at low cost and high quality for people all over the world.
Dr. Lee, a final message for our listeners, but also maybe ask one more question. Maybe this time next year, next Chuseok, do you think we will be in a better place than now, or do we have to think even longer than that with this COVID-19 pandemic?
Well, I think by the time you mentioned, the effects of the vaccines might have kicked in. And we've learned through the past year and a half that vaccines and masks provide the best protection. So I'd like to finish by telling the people, call upon people's sense of duty and empathy to join in and wear masks, getting vaccinated. And I know it's asking a lot, but again, exercise the curve flattening spirit they had from the outset. That's the message I want to deliver to our listeners.
Dr. Kim Seung-taek, finally as well, your final thoughts, and maybe if I add a question, will there be an end to the COVID-19 pandemic at some point in the future?
Maybe we can be some less burden compared to the that we have right now, but the viruses will stay with us probably forever. One of the reasons is that this is not just causing just infections in the human. This is actually spill over from some of the animal origins. So this kind of a zoonotic, the viruses. In these cases, the viruses, even though theoretically, imaginary, we just completely eradicated the viruses from the human society. Some remnants of the virus will just reside in the animal kingdom. And then if there is any chances, then the viruses will again just spill over to the human. And then one of the biggest host of some emerging viruses is bats. And the bats is actually occupy a substantial portion of the mammals and the entire the planet. So we cannot actually just eradicate all the bats out of this planet. So it is really just difficult somehow. So we have to actually think about just a way to just coexist with the virus by just developing and just very effective vaccines and also some drug development. And then lastly, I was in line with Dr. Jerome Kim said. I think I want to just quote that no one is safe until everyone is safe.
Yeah. On that note, we'll leave it there. I'd like to thank our panel of guests today, Dr. Jerome Kim, Dr. Lee Han-sung, and Dr. Kim Seung-taek. We appreciate you making the time to come in today, and I believe it will have been a very interesting insight for our listeners. We hope you have a great Chuseok holiday, and we'll perhaps talk to you again next time.
Thank you.
Thank you.